Hi, I'm Chris LaRosa, and I'm doing a presentation on PCOS, also known as polycystic ovary syndrome. So first, it's important to understand the pathophysiology of PCOS, which is when the endocrine imbalances results in the high levels of estrogen, testosterone, luteinizing hormones, and decreasing the secretions of follicles stimulating hormones. This syndrome is associated with a lot of problems, including the hypothalamus, pituitary ovarian axis, and androgen-producing tumors. So some important clinical manifestations to focus on with PCOS includes obesity, increased growth of hair in areas where hair is not normally grown, irregular menses and amenorrhea, and also infertility. But the three most important key clinical manifestations of PCOS is mainly obesity, the abnormal hair growth, and the infertility. And later on, I'll be explaining some interventions and medical management that is usually used. But it's important to understand the diagnostic testing for PCOS. As of today, there's not any conclusive testing to officially diagnose PCOS, but usually there are multiple testings that can help identify it, and these include a pelvic exam, which would inspect the reproductive organs and assess and identify any growth or abnormal development. Another would be blood testing, and for blood tests, these may be used to measure the hormone levels, and for any possible causes that may be related or not related to PCOS. And finally, another test that could be used would be ultrasounds. And ultrasounds would be helpful to assess the appearance of the ovaries and assess any abnormalities present. It would also assess the thickness of the cervix. So medical management and interventions. These would include various medications. First, it's important to understand the medications associated with ovulation. These include gonadotropin hormone medication, which are usually given by injection. Also administering Clomid and oral anti-estrogen medication, which is usually used during the first part of your menstruation cycle. And other medications that could be used would be metformin oral medications, which would be used for type 2 diabetes and improved insulin resistance. But something to be aware about for metformin is it can also slow the progression of type 2 diabetes and also help for weight loss, which is also another factor associated with PCOS. Also, there's medications to help reduce hair growth, which includes birth control, which decreases the production of androgen. There's spirulactone, which is blocks the effects of androgen. And also there's electrolysis, which destroys the hair follicles of the abnormal hair growth by destroying the follicle itself. So for the NIC interventions, For obesity, there's exercise promotion, nutrition management, and the support group. So for exercise promotion, it's important to encourage the patient to be physically active and to help lose weight, and nutrition management, being able to provide a balanced diet intake on foods and fluids, and support groups. This can be very stressful for the patient, so it's important for the patient to have support groups to be able to express and their anxiety. The next nursing intervention would be disturbed body image. So for disturbed body image, it's important to assess for body image enhancement, which is improving the patient's conscious and unconscious perceptions and views on their body weight and their appearance. Another one is anticipatory guidance preparation. It's actually anticipatory guidance, and this one is used to prepare the patient for any anticipated situation of crisis. And it's also important to identify their self-esteem enhancement, which helps assist the patient to increase their personal judgment of themselves. And some more interventions that can be used for PCOS, of course, maintaining a healthy weight, which can help reduce insulin and androgen production, maintaining a good condition, maintaining a good diet, which includes limiting on carbohydrates and to reduce on insulin levels, and also anxiety and depression. Allow the patient to express their feelings, and it could be complications and difficult to cope with abnormal hair growth and the weight gain. So it's important to identify that. Now for my hot topic. It explains about improving the accuracy of diagnosing PCOS. So like what I said earlier, there's not really a specific diagnostic test to identify PCOS. So this article explains a way of identifying it. And it's a random controlled trial, and these participants were randomly assigned to experimental group from a 1-to-1 ratio. All statistical tests were double-sided, considering they're trying to find a p-value of 0.05. In the results they found, they discovered that clinical indicators such as the LH and the FSH ratio, and the insulin levels had good correlation with the metabolomic results, and their findings indicate that there's a potential of developing a diagnostic and therapeutic strategy of PCOS using the biomarker system. And the results show that the trial conducted shown metabolic indices are more accurate and effective in identifying PCOS, which is really good. And these are my references.